Hey everybody, Dr. Quinn here with Ozark Holistic Center, and today I get this wonderful opportunity to be able to have somebody here live kind of going through this process. And actually, Copper here is a patient that I was able to work on and has this really cool story. And so we're going to talk a little bit about the process of some of the things we can do working on infants and why we kind of do that. In his case, he had, pretty much since delivery, right, he had this kind of arch to his back. So he was arching really strong. He just seemed to have this reflex of just kind of pulling him back in this direction. And they could tell it was making him uncomfortable. He was having a hard time, staying in car seats. He's having a hard time sleeping because it's kind of constant pull. So one of the first things we assess and look at when it comes to infants is actually their cranium. So our cranium is made up of several different bones. They come together along lines called sutures. And so we kind of get taught and learn where those sutures are and how it is that they should actually come together. And in his case, one of the first questions asked was C-section versus natural birth. And the reason why this matters in this case is when babies are actually go naturally through the birth canal, those sutures are actually designed to actually get kind of squished together. They overlap each other like this because the size, there's a need to be able to do that. And so when actually after they pass through, it expands out. There's this really quick expansion that moves it outwards, and it pushes this pressure back out in order to put them into the position in place that you want it to be in. And so that process actually kickstarts some of the what we call CSF flow, which is some of the fluids and stuff that's inside the brain that surrounds the brain, surrounds the spinal cord, and it has a certain effect that needs to happen. And so those that are C-section babies, you actually will notice they seem to almost have this perfect looking cranium. And the reason why is because they don't actually go through that expansion process. So there's not as much separation, there's not as much distinction to those cranial bones. But it still plays this important role because we got to kind of help that sometimes to get that same pumping action started that is supposed to happen, which is actually your own natural breathing mechanisms. So we'll go in and actually go through an assessment process of identifying where those are, which ones actually seems to be off. It is a matter of pressure and kind of a releasing through those cranial sutures. And then sometimes that releasing actually applies down further into the spine as you try to kind of connect some dots of what's causing some of the tension and the pull and how to actually release that tension and pull in this process. And in his case, it took a couple different times of doing it, and then that arching mechanism really calmed down, which then allowed him to help sleep better, do all these things, and now he's a pretty happy baby. One of the coolest stories I think I have in practice actually came from this very type of scenario. We had an infant that was in here. It was actually similar age, if I remember right, about 8 months. And pretty much since they were born, they actually were having this issue with breathing. They would actually just simply stop breathing. Talk about the most terrifying thing for a parent. Their parents came in going we're literally driving down the highway and we'll hear our infant stop breathing, and you're driving trying to figure out, do I need to pull over or are they going to start breathing again? And so it was this process that we had to go through. By doing that, you're able to alleviate a lot of the tension and pressure that was actually there on through the neck, through the tracheus, esophagus, those areas. And it really just took, in that case again, I think it was 3 or 4 of these sessions, and that whole thing just stopped. The whole breathing thing just stopped. And they were told that pretty much their whole development, childhood development, they were going to have this issue. And we were able to get it to stop, and actually hasn't started, and we're now a year and a half later, and they've never had a problem with it again. So there's some pretty amazing things that can happen with kids, and that cranium and correcting those cranial sutures. So
at what point should people bring infants in?
At what point should people bring infants in? And that's a commonly asked question. Myself, each of my children, I assessed pretty much right off of the bat. So there's other complications that can happen even with natural births. There's not exactly this perfect way of to go through that process. And so depending on their position coming out, they can often get twisted on, pulled on, and there's a need to actually assess and make corrections. I had a daughter that her arm got stuck, and so after she came out, there was a lot of work to do on the arm. And if anyone that's had chiropractic care, that's one of the thoughts people have is oh, you're going to get in there and crank on my baby. The answer is absolutely not. Working with infants, it's much more of it's a touch, it's a pressure. Their bodies respond really quickly, and so there's not this need to have much force or anything like that behind that process. So really, I would love to be able to actually kind of assess every baby that's born, after delivery, after that process, at least to have an initial assessment. For sure, if you're seeing any kind of things that you're struggling with, I mean, you've got acid reflux, super common thing with infants. I've seen the cranial work correct that a lot of different times. Sleep problems is another common thing. Latching for breastfeeding moms, an issue with the latching, and sometimes that can be corrected actually with the same kind of cranial work, and sometimes actually what we call inner cranial work, is you're going to work on the palate and those kind of things there in the mouth to correct that latching process. And all that can be done over a pretty relatively short period of time when it comes to infants. They respond so well to this kind of care. It's really neat.